Okay, so I just got a report from the ambulance. I'm just introducing them, whatever. And patient was brought in by the ambulance after a belly flop into the pool. Patient is a 29-year-old female. Complains of chest pain and shortness of breath, stating that she can't breathe, and the patient has no past medical history. So first I'd walk into the room, knock, knock, knock. Hi, my name's Carly. I'm gonna be your nurse today.
Hi.
Hi, before I get started, can you tell me your name and date of birth?
Megan Hosseini, 5/30/91.
Okay, perfect. It matches up. Any allergies, Megan, to any medication?
No.
Food? Okay, great. And can you tell me where you are right now?
I am in the hospital.
Okay, and then what's the date today?
It is the 11th of July.
Okay, and who's the president?
Donald Trump.
Okay, and so patient is ANO ×4. She appears alert, no loss of or altered consciousness. She's tachypnic, shortness of breath. Otherwise, her speech is clear, and she appears kempt, well groomed, and just trouble breathing. Okay, Megan, so what brings you into the ER today? Can you describe briefly?
I have pain in my chest. It's hard to breathe.
Okay. So, and the pain, is it just in your chest when you breathe in and out, or is it?
Yes.
Okay. And did that happen when you belly flopped into the pool, or was it before?
After.
Okay. And about how long ago was that? An hour?
Well, like an hour, yeah, right after it happened.
Okay. And then on a scale of 1 to 10, what would you say your pain is?
Like a 9.
Okay. And what does it feel like? Is it sharp and stabbing pain?
Yeah.
Okay. And it's not radiating anywhere else to your head or your
No,
abdomen?
it's just
your
chest and lungs. Yeah.
Okay. So first let me wash my hands and put my gloves on. So I just did that. And then I'm just going to be doing a quick physical assessment on you to kind of see what's going on. I'm going to start with a few focused assessments to see what your respiratory status is doing in your chest. And then I'll do a full head to toe to get the big picture. Is that all right with you?
Yes.
Okay, perfect. So first I'm going to take a look. Go ahead and, if you can, sit up for me. So I'm going to inspect the chest area first. I notice that there's tracheal deviation to the patient's right side. There's shortness of breath, use of accessory muscles, patient is tripoding. And the chest expansion is asymmetrical. It's greater on the right and diminished on the left. And then I'm going to go ahead and inspect. Skin looks clear. There's no bruising, no laceration. Skin is intact. No flail chest or protruding ribs. And then next I'm going to go ahead and palpate. So I'm just going to lightly touch here. Skin is warm, dry. And then I'm going to check for any subcutaneous emphysema. There is a little crackling on the patient's left side, and it's absent on the right. Okay, I'm just going to go ahead and take a listen to your lungs. Every time you feel my stethoscope, take a deep breath in and out. Okay, lung sounds are clear on the patient's left side, right side. Lung sounds are diminished and absent on the left side. No crackles heard or anything on the right side, no adventitious sounds. Okay, now I'm just going to go ahead and take a listen to your heart. Okay, S1, S2 heard, no abnormal heart sounds, no murmurs, gallops, or S3, S4. And then I'm going to go ahead and take a look at the patient's back. First I'm going to inspect. Skin is dry and intact. There's no bruising, no swelling, redness, no protruding ribs. Chest expansion is asymmetrical. And then there's no pressure wounds around the shoulder blades or the coccyx. So I'm just going to go ahead and take a listen again. Every time you feel my stethoscope, deep breath in and out. Lung sounds clear on the right side, diminished and absent on the left. And then now I'm just going to have you take a look, open up your mouth and say ah. Okay. Mucous membranes are pink and moist. There's a little cyanosis around the patient's lips. And go ahead and lean back just a little bit. So JVD is present. Okay, and so I'm finished with your focus respiratory assessment. So now I'm going to just go ahead and scan you real quick. So first I'm going to start by inspecting the head. Hair looks evenly distributed, clean, good hygiene, no lice, nits, anything like that. No, no lice, that's good, especially because we live together. And no bumps, bruises, masses, lesions, anything like that. Go ahead and look at me. Smile for me. Raise your eyebrows. Okay, face is symmetrical. And then, so go ahead and look straight forward, and I'm just going to shine a light into your eyes real quick. So, that side, that side, and then go ahead and follow my pen light with your eyes. Okay, patient is Perla. Pupils dilated 3 millimeters to 2 millimeters, and no glasses or contacts, anything, no blurred vision, no double vision. No. Great, and then go ahead and lift your head back. I'm just going to peek in your nose. Okay, there's our patent, and there's no drainage. Mucous membranes are pink and moist, and then I'm just going to check your ears. Okay, ears are clear, no drainage. They are symmetrical. And then just going to feel, palpate for any lymph swelling or tenderness. Does this hurt at all when I do this?
No.
Okay. Check skin turgor, no tenting. And then I'm going to inspect your arms. So first, I'm just looking, there's no bruising, swelling, arms are symmetrical. You don't have any previous surgical history like shoulder replacements or problems, okay. And then I'm gonna check temperature, skin is warm, dry to touch, intact. And then check cap refill, less than 3 seconds, radial pulses. There's no clubbing on her fingers, brachial pulses. Okay, and then I'm going to check carotid. Okay, carotid pulses are +2 bilaterally, and the patient's upper extremities are +2 bilaterally for her pulses. There's no clubbing on her fingers. I don't feel any crepitus or anything up here. Go ahead and squeeze my hands as hard as you can. There you go. Hand strength is equal on either side, is strong. Go ahead and raise your arms up like this, down to the side. Okay. Full range of motion for bilateral upper extremities. So then I'm going to have you lay down for me, please. I'm just going to take a look at your abdomen. So first, inspect. Patient's abdomen is flat, symmetrical. There's no masses, no bruising, no rashes, redness. Skin is intact. There's no lacerations or signs of bleeding. So then, and any nausea or vomiting, Megan?
No.
Okay. So first, right lower quadrant, 15 seconds. Right upper quadrant, 15 seconds. Left upper quadrant, 15 seconds. Left lower quadrant, 15 seconds. So bowel sounds are normoactive in all 4 quadrants. And when was your last bowel movement?
This morning.
And was it formed or was it diarrhea?
Formed.
Okay, and you haven't had diarrhea lately or anything?
No.
And no straining or anything when you go to the bathroom?
No.
Okay, great. And then I'll percuss. Okay, it's normal resonance in all 4 quadrants. And then I'm just going to lightly palpate. Tell me if you feel any pain or tenderness.
No.
Okay, and then I would assess the patient's perineal area. First, I'd just inspect, make sure there's no bruising, lacerations, the skin is intact, there's no foul odor, anything like that, so it all looks good. And when was your last menstrual period?
A couple weeks ago.
Okay, and are they regular?
Yes.
Okay, good. And any pain with urination, difficulty, anything like that?
No.
Okay, great. You can go ahead and sit up. Alright, and then next we'll do your legs. Any hip problems or anything like that before we
No.
get started? Okay. So the patient would be in a gown. First I'd look at the legs. They're symmetrical. There's no swelling on either side. No bruising. Skin is intact. Yeah. So then I check temperature. Skin is warm and dry. Cap refill, less than 3 seconds. And I'm just gonna check your feet. Skin is intact, there's no ulcers on the feet or any cracks. And then I'll go ahead and check your pedal pulses. Okay, and then popliteal. And then femoral pulse. Bilateral lower extremities pulses are +2. There's no clubbing on the toes, and there's no discoloration. Let me check for edema. There's no edema present in the ankles. And then go ahead and raise your feet out in front of you. Point your toes, flex your feet. Move one foot in a circle, move the other foot in a circle. And then bring your knee to your chest. Okay, any problems with balance lately? Any falls?
No.
Do you use any walking aids? Walker? No. Okay. Any dizziness or anything since your belly flop?
No.
Okay. And then, are you currently taking any prescription medications?
No.
Okay, and you have no history of asthma, no history of any pulmonary or lung infections, anything like that?
No.
Okay. Okay, great. Well, Megan, I am all finished with your assessment. I just have a couple more questions. They're a little bit weird, but we have to ask everybody. Do you feel safe where you live currently?
Yes.
Okay, good. And nobody's trying to harm you? No abuse from anyone, boyfriends, parents?
No.
Okay, great. So you're safe here at the hospital with us. I'm all finished with your assessment. Thank you very much. I'll put your bed back down in the lowest position with the side rails up. And here's your call light if you have any questions. And I will be back to check on you shortly.
Thank you.
Okay. Then I wash my hands, or take my gloves off, wash my hands, document, and leave the room. The end.